The situation happened where the child died because she received, as I already explained in the previous video, 3 milliliters of epinephrine, right? So today I want to bring up the following situation. Where is the nurse? A lot of people said, where's the nurse? Where's the nurse? Where's the nurse? The doctor's desperation, the unprepared technician. Unprepared in what sense? Man, she knew something was wrong. She had never done it before. She admits this publicly and still did it. So I need to bring this topic to you, which is a delicate subject, so you can start thinking better about your career. That's the only intention. Those who are going to judge already know, right? First of all, up there, he is always judging, right? God is the one who will always judge you for your actions. What you do that no one sees, God is watching. There's a judge on earth, but who is iter anyway? I'm nobody. I'm going to talk here about the situations. I'm going to talk about the Swiss cheese theory, why it could have been avoided anyway. I'm going to talk about the nurse. So we have several situations here that we're going to discuss. Share it, really. If you like the content and want more people to avoid problems that should never have been a problem. Situations that unfold into a catastrophe that could have been avoided. So, if you think it's interesting, really share it. Leave your comment. More people should read it and think, wow, that's cool. What an interesting perspective. Shall we get started? Here's the thing, guys. Many people say the doctor wasn't a pediatrician or didn't have a specialist qualification registration. Man, stop that. Let's go. First step, the doctor wasn't qualified to handle the emergency. That's the point. In the emergency room, the person who has to work there is an emergency physician. An emergency physician is the guy who's qualified for emergencies. Emergency physicians work in the emergency room, regardless of whether the patient is an adult or a child. In this case, the emergency physician, whether male or female. In the case of nursing, the nurse has to be an emergency specialist. That's why I say, if you keep taking these useless postgraduate courses that don't teach emergency skills, things will eventually go wrong for you. Trust me, just sit down and study. For the nursing technician, there are not many other options. As far as I know, Brazil doesn't have many post-technical emergency care courses. I even tried to take one, but it's more bureaucratic than anything. That's Brazil. Education in Brazil is a bit complicated. So, let's go. The fact that she's not an emergency specialist is a problem. Okay, just remove the part about her not being an emergency specialist. Second problem, she was seeing pediatric patients without having the necessary knowledge. Or if she did have the necessary knowledge, she made a very serious mistake. And the worst part, why does it seem easy to talk about it? Does it seem easy to say that the doctor made a mistake? Since I'm on the other side, after you've analyzed so many headlines, now imagine a family in front of you. Just imagine that. If you're a doctor, picture a family with a boy suffering from laryngitis and serious breathing trouble. The doctor did what she thought was best. But why do we end up questioning the professional's qualifications in this kind of care? It wasn't because she prescribed incorrectly, because the mistake was very obvious. But it was what happened after the problem was already there. You know, a good professional is someone who knows what they're doing. So, if you did something wrong and you know you did it wrong, you already start thinking about how to reverse it. I made content here. If you haven't seen the video, watch it. So what now? How do we fix this? It's not just about calling or messaging the boss, because that shows a lack of preparation. It showed total lack of preparation. That's the point. I'm not saying she did this right, it's wrong, but what I mean is this. It's not because of this that we judge someone as unqualified to handle an emergency. It's what happened afterward. So it proves that this was a mistake and the person was really unprepared to prescribe medication. So much so that from the leaked messages, because I don't even know how ethics work in this hospital, everything leaked, all kinds of messages leaked, you saw it. She was desperate, wanting someone from the pediatric intensive care unit to come down. Or anyway, to be able to help. Desperate, she sent a message to the boss. Come down now. I made a mistake. I did it wrong. The child is like this and so on. So you can see the lack of preparation in her conduct. There was no emergency doctor conduct. It was someone unprepared, desperate for someone to go there and see what could be done. All right then, close that window. Of medicine, which isn't related to medicine. I'm a nurse. Let's discuss nursing. If you've never worked in an emergency room, it's easy to make comments online without understanding how it really works. Now I want to see if you've ever worked a shift in the emergency room. Emergency room nurse, you don't check the prescription, my friends. What are you thinking? Did you stop to think? I don't know how big this hospital is. I used to work at a hospital that had 3 pediatricians, 3 internal medicine doctors, 6, there was a general surgeon, an orthopedist, an ear, nose, and throat doctor, and a gynecologist. I have 10 doctors seeing patients and writing 10 prescriptions. Let's say each doctor spends 15 minutes to see a patient, although it could be more or less, okay? Let's say half an hour. If 10 doctors see one patient every 30 minutes, I have 10 prescriptions every half hour, 20 prescriptions every hour. In what world do you live in where an emergency room nurse checks the prescription that comes from the doctor before it's released to the pharmacy? Man, you guys need to study, that's why I say this. Who did you have classes with in college or in technical school? No one explained how things work or the departments. That's why I say this. You need to study with someone experienced. Inexperienced people just sell you a fantasy, a Bobby's world. Oh, the nurse is responsible for giving the prescription. In what world? I'm saying this using a very conservative number, 20 appointments per hour, 20 prescriptions coming out per hour. Do you guys really think that a nurse can actually look at the prescription? Scheduling is the biggest mistake I've seen in the comments. Oh, the nurse should have scheduled it. What scheduling if the medication is given almost immediately? We schedule staggered or alternating medications for inpatient care, wards, and intensive care unit. I'm not defending the nurse, for God's sake. I want you to understand how an emergency room works. In the emergency room, we don't keep looking at prescriptions. No. Do you know which prescription the nurse looks at in the emergency room? The prescription for admission. Mr. Jose arrived with acute pulmonary edema or with pneumonia. Let's admit Mr. Jose. We take the prescription, schedule the admission prescription, and when he goes to his assigned ward, that prescription has already been scheduled. The antibiotic was given, as infections usually require one. It already began in the emergency room. This is the prescription the nurse checks because, guys, so will there have to be a nurse just to look at the prescription? Where does that even exist? Even Albert Einstein wouldn't need a nurse just to review a prescription. The doctor writes it, so why would a nurse check it first? That's why I say everyone needs to have their own level of knowledge. At least as far as I know, there's no way to have a nurse just checking prescriptions, because otherwise, what about the rest of the tasks? There's already a lot to do. Complications arise, requiring procedures, patient admissions, transfers, and handling emergencies. Man, there's so much to do. Do you guys think there's time to check all the prescriptions? Just imagine it's impossible. Otherwise, we'd block all care. Do you want a nurse to do that? Cool, I think that's great. So let this guy just do that. The doctor does it there, makes a small line while the nurse just watches prescriptions. It's ridiculous, okay? That's why I say, you have to study, for God's sake, people. You have to study. You can't just say things without knowing, since that's not how it works, right? I'm not protecting any nurse. But I want you to understand that nowhere, at least as far as I know, is it possible to do this kind of verification. Because the process doesn't allow that, okay? All right. Then the doctor prescribes this here, 3 milliliters every 30 minutes. In other words, it would be 9 milliliters. I believe that 9 milliliters weren't administered because there wasn't enough time, right? In the first dose, 3 milliliters, and then, well, the whole catastrophe happened. With this prescription, a nursing technician takes it and says, look, mom, dad, right? Look, the doctor prescribed this, and so on. I'll get you settled and send your prescription to the pharmacy for your medications. And when it's time to dispense non-material medications, the professional just goes and does it. But along the way, from what I understood, there was a question from the mother regarding the prescription. I don't even know if the mother works in healthcare, but there was something the mother said. Hey, but wait, is it really here? And the technician said, really, I've never done it through this route, but it's prescribed for this route. It hurts, right, to think that it's going to continue from this point. So guys, it's up to each person's knowledge. The mother thought, The doctor said the technique was never done, but she agreed. So it must be that it has to be done this way. And from there, all the problems start. So when we talk about Swiss cheese, right? It is a theory that maybe not many people have studied. When we evaluate ways to solve problems to avoid mistakes, right? I won't go into patient safety now since it isn't relevant at this moment. Here's the point. A prescription error occurred. There was a nursing error at first before administering when they noticed that something was wrong and so on, and then proceeded. And we have here a pharmacy error because here's the thing, guys, trust me, no vasoactive drug at this magnitude is requested from the pharmacy. In an emergency, you open the card. Oh, Eder, but why not? There's something called an emergency card. Guess what for this? I don't even know if the pharmacy technician is actually a technician, an assistant, or has any pharmacy training. Some hospitals do that so-called smart saving, right? Not to say the opposite. They let anyone dispense medication with only a pharmacist present in the central pharmacy. At the hub, there's someone who might not understand much. I'm not sure if that's true at this hospital. If it's a pharmacy technician, that's even worse. If not, that is, the technical manager of the pharmacy will be held responsible for that. So wait a minute, Tay, did they give you 3 ampules of epinephrine on the tray? There wasn't an emergency in the emergency room. At least I don't think so. If there was, what did he say? Man, take it from the cart, we'll replace it later. There are so many mistakes here. It's just poor preparation. It's a crazy flowchart. You can just grab the medication from the cart here. If it's an emergency like cardiac arrest and the patient is down, use epinephrine. Should I get it from the pharmacy? No, Eder, I opened the cart. Why do we open it? For emergencies. If this was an emergency, why wasn't the cart opened? So, was it really an emergency or was it an emergency? Was it an emergency or not an emergency? So, we start by questioning. The first thing is that this kind of medication shouldn't be in the pharmacy if there's a cart. This medication is high alert. Not everyone should have access to this medication. When I say anyone, I mean literally. The nursing technician wasn't supposed to have access to this medication through the pharmacy. He can have access through the cart. Through the pharmacy, there should be, or at least the best hospitals should have it, a system so that only the nurse can. Then in this case, since it's a high alert medication, it goes to the nurse because the person who handles high alert psychotropic medication is the nurse. Hey nurse, I can't release this medication with this prescription. You need to provide authorization. Do you understand how many mistakes happened? So, there's no workflow. So can I get a norepinephrine from the pharmacy if it's prescribed? If anything is prescribed, like, I don't know. If it's prescribed there, can I get fentanyl from the pharmacy? Can I get any sedative, any vasoactive drug? Can I get anything? So, you see, the layer of error isn't just from the doctor, it's not just from the technician. It's everywhere, the whole institution. When you analyze the layers of errors there, man, the disorganization of the workflow is glaring. And this is an important point for you who are working or for you who will work, for you to understand that a flowchart is important. Bureaucracy is important to save lives. Is it bureaucratic that a technician can't get epinephrine at the pharmacy? Yes. But in this case, if there was a lock, hey, we don't release vasoactive drugs to nursing technicians unless it's a nurse with the justification. And the pharmacy technician could very well, there could be a second lock at the pharmacy, which would be the following. I can only release it with the central pharmacy supervisor's approval, since there won't be a pharmacist present. The medication might only be available at the pharmacy. Eder, but that's too much bureaucracy. Yes, but the card has everything. The patient is never left unprotected. Eder, the patient died before the medication arrived. It's in the emergency cart. My point is, they didn't open the emergency cart. They got this from the pharmacy. If it was taken from the pharmacy, they need to improve their workflow. How is she dispensing the medication from the cart? So why is there a cart? If it's an emergency, do I get it there? Or maybe it wasn't an emergency. So if it wasn't an emergency, that's the point. If it's not urgent, why get this medication here? Guys, that's why you need to study when analyzing the cascade. There's a lot to it. So in other words, the technician has his share of responsibility. He's to blame for what he did, because that's in our code of ethics. At that moment, when the mother questioned him, he could have said, wow, there really is something strange. I'll talk to the nurse or I'll talk to the doctor. He could have done that, but anyway, it's done now, right? After it happens, well, giving the solution is easy, but I always remind my students, when in doubt, ask your colleague next to you, ask your nurse, even ask the doctor. It's a question. It's better if you get scolded, since we're afraid of it. I don't care if I get scolded, I just don't want to risk my patient. Look, it just got even worse. Now it's everyone, you know? So there were several layers of mistakes, and then, right? The institution will pay for its mistake, and the professionals will pay for theirs. But for me, guys, paying for the mistake is one thing. The mother lost her child. For me, that's priceless. I'm not saying someone needs to be arrested or lose their nursing or medical license, because you can always start over. If I lose my nursing license, I'll move on. That's fine for me. But for someone who lost a child, life will never be the same. Ah, Eder, but you were sued and have to pay X thousand. You sell something, pay that off. But for someone who lost a child, money means nothing. That will fill the whole of that pain. Consider that and set your egos aside. No one was born knowing everything. Be more humble. Ask people about what you're unsure of. If you have a question, just ask. Because if you had this question, maybe it's God putting a warning in your heart. Be careful, my daughter. I know you lack experience, so I'm warning you. I'm here for you. But if you ignore these kinds of signs, then later you pay the price. Okay? Pay the price up front. Buy any course. It doesn't have to be mine. Buy from anyone you trust will offer a good course, but buy courses that will solve your problems. Don't buy courses just to get a certificate. Buy courses to get real qualifications, where you'll feel proud to have the knowledge to truly save lives.